Hey everyone, welcome back to Inside Our 20s. You're listening to another Uni Bite episode, which are quick, digestible episodes where I break down uni topics into something that actually makes sense. Today's focus is on traumatic brain injury, or TBI. We'll talk about what it is, how it happens, and how we measure severity, and what it means for recovery and mental health. So first, the definition. A traumatic brain injury is an acquired brain injury that happens when external physical forces, like a hit, fall, or accident, apply sudden mechanical energy to the brain. There are two main types: open or penetrating injuries, like when an object actually goes into the skull. These are less than 10% of TBIs. And then there are closed injuries, which are way more common, caused by impact or sudden movement without penetration. So TBI is surprisingly really common worldwide. In the US, mild TBI alone is estimated at 600 cases per 100,000 people per year, and not everyone even goes to hospital. In New Zealand, the rate's even higher, with 790 cases per 100,000 people per year, and 95% of those are mild. In Australia, around 22,700 people are hospitalised each year, with men between 15 and 24 being most at risk. And here's the key stat: 80% of hospitalised TBIs are still classified as mild. So, what are the main culprits of TBI? And they depend a bit on age. So, falls are the biggest cause overall, especially in children and people over 45. Transport accidents like cars, bikes, motorbikes are most common in adolescents and young adults. Assaults can also occur more in young adults. And then there's sports. Think footy, rugby, equestrian, motorsports. Concussion hospitalizations in Victoria went up by 60% in less than a decade. There are also risk factors. TBIs are more common in lower socioeconomic groups, in people with substance abuse histories, and those struggling at school or work. So, what actually happens in the brain? So, what's going on inside the head when someone has a TBI? We usually break it down into three stages. Number one, immediate or primary effects. These happen at the exact moment of injury. This includes things like scalp injuries, skull fractures, bruising or tearing of the brain tissue, bleeding, also known as hematomas, and axonal injuries. That's when nerve fibers get stretched or torn. So the frontal and temporal lobes are particularly vulnerable. You might also hear about coup or counter coup injuries. That's when the brain hits one side of the skull at impact and then bounces and hits the opposite side. A really big one is diffuse axonal injury, where nerve connections share part due to rotational forces. This is one of the main reasons for loss of consciousness or coma. Number two, secondary effects. These come in the hours or days after, things like lack of oxygen, swelling, raised intracranial pressure, or reduced blood flow to the brain. And number three, delayed effects. These can emerge weeks to years later. Examples include brain atrophy, hydrocephalus, epilepsy, and even infections if surgery or fractures were involved. So, what's the difference between mild and severe TBI? It is about how much damage occurs and how long it lasts. In mild TBI, what we often call concussion, axons may stretch but not break, and most people recover within weeks to months. In moderate to severe TBI, there's more obvious bleeding, tearing, and longer lasting damage, often with permanent changes. So, how do we measure severity? There are two main ways we measure TBI severity. Number one, the Glasgow Coma Scale. This is done immediately after injury and looks at eye opening, motor responses, and verbal responses. Scores range from 3, deep coma, to 15, fully alert. A score of 8 or below usually means coma. But a Glasgow Coma Scale of 15 doesn't mean you're out of the woods, because you could still have post-traumatic amnesia. So, post-traumatic amnesia, this is considered the best predictor of severity and outcome. PTA is that foggy period after injury when you're confused, disorientated, and unable to form continuous new memories. If that lasts less than 24 hours, it's mild. If it's between 1 and 7 days, it's moderate. And if it's longer than 7 days, that's severe. There are standardized tools like the Westmead PTA scale for moderate and severe cases and the abbreviated Westmead PTA scale for concussion in emergency settings. Now, on top of PTA, people can also have retrograde amnesia. That's when they can't remember events leading up to the injury. Usually, it's short and shrinks as recovery progresses. Now, what are the neuropsychological aspects of TBI? So, neuropsychologists get involved in two main phases. So, number one is the acute phase, so days to weeks after injury. Testing helps track PTA, assess decision making capacity, and guide discharge or rehab needs. And number two, the chronic phase, so months to years later. So, more detailed testing, usually 3 to 4 hours, looking at intelligence, memory, executive function, attention, motivation, and emotional well being. We also use mental health questionnaires because mood, stress, and PTSD are common after TBI. So, what happens long term? With mild TPI, most people recover fully within weeks to 3 months. Athletes usually bounce back in 2 to 21 days, and the common issues are slowed thinking, attention lapses, and short term memory hiccups. With moderate to severe TBI, recovery is longer, rapid in the first 6 months, slower up to 2 years, and then it plateaus. Some people are left with persistent memory, attention, and processing speed deficits, as well as behavioral changes like impulsivity or mood swings. Overall, the more severe the injury, the greater the risk of long term disability. So, now let's talk about mental health and TBI. So, TBI isn't just about cognition. Psychological disorders are really common across all severities. Depression, anxiety, PTSD, and even psychosis can occur, especially if someone had a pre-injury history of mental health issues. One study found PTSD in more than a quarter of severe TBI patients 6 months after injury. So, here are some case examples. So, to bring this to life, let's quickly touch on a few real cases. So, Adam, a 23-year-old cyclist, had a mild TBI with a small brain bleed. His memory test fluctuated before stabilizing, showing how recovery isn't always linear. Connie, a 39-year-old driver, had surgery and pain meds after her accident. She came out of PTA fairly quickly and her memory performance steadily improved. James, a 40-year-old assaulted with a cricket bat, needed emergency surgery. A year later, his IQ was still high, but he reported headaches, memory issues, depression, and PTSD. This shows how TBI isn't just about the scan results, symptoms can persist even when standard testing looks good. So, to sum everything up, TBI happens when external forces injure the brain. Most cases are mild, but severity depends on consciousness and memory recovery. Screeners like GCS and PTA are vital for assessment, but long term neuropsych testing and mental health support are just as important. And finally, every recovery is unique. Scans and scores don't always tell the whole story. So that's it today for our Unibite episode. If this helped you get your head around traumatic brain injury, share it with a friend who's also cramming for exams. Thanks for listening, and I'll catch you next time. Bye.